So in the old-fashioned days, we used to say you had to have like X number of years of practice before you would apply. But I don't think that applies anymore. I think that some students are in undergraduate. They already know they want to be a nurse practitioner. They know, what subspecialty they want to do. And if they have a passion, if they're very clear about it, I think they should apply straight out of undergraduate school. I think that one of the things that they should continue to do, though, is work just a little bit, so that way they can practice their skills while they're in school. So, we'll teach them the things that they need to know for the community, but being able to still listen to patients' heart and lungs, or being able to talk to patients, being able to interact with other members of the healthcare team, that's really an important skill that you learn while you're working. But I think that you can do that while you're in school as well, even on a part-time basis. I don't think you need to work for a period of time. On the other end of the spectrum, I also get students who tell me, I was really worried about coming back. I didn't want to be the oldest student in the class. I think this is also something that adds to the robustness of our program, that we have students at all levels of experience and age and geography, so that way they're able to bring different perspective to class. So I think that that's very helpful for our program as well. So we start off with big foundational courses, so courses where all of the subspecialty groups are together. So we try to really develop a cohort, so you'll have pediatrics, acute care, primary care, midwives, all kind of in the same courses, where we teach them pharmacology, pathophysiology, advanced health assessment, and then we break off into the subspecialty groups a little bit more in the second year, where we're teaching students about how to manage acute illnesses, for example, then chronic illnesses. And this is where we have our students paired with a clinical site in the community, where they're able to have lecture and then see the same thing within the community as well. So then we have 3 semesters of clinical where they're able to do that. We find our clinical sites for our students. So we're one of the only universities that does that. We have developed a long relationship with a lot of our preceptors. So our preceptors know our program. They know what students are coming in with at which semesters, so what skills they bring. They know how to foster students who are in a specific class in order to develop the skills they need to progress. So we find those placements for them. Secondly, all of our faculty that are in the program teaching also practice, so I think that's a huge advantage. So our students are able to learn from people who are actively still seeing patients in the community, as opposed to somebody who used to practice, several years ago and now just teaches. So this is one of the reasons I love nursing. So you get 1 degree and you have so many different things that you can do with that. So with an undergrad degree, you can graduate and work in a variety of different settings. So you can work with, pediatrics or OB, maternity, or adults or ICU, like all with the same degree. With Adult-Gerontology primary nurse practitioner, you have the same type of flexibility. So you can work in the community in an outpatient primary care clinic. So that's what the majority of our graduates will do. But you can also work in subspecialty clinics. So we've had some of our graduates who go and work in cardiology, for example, and even more than cardiology, they specialize in procedures or electrophysiology or tiny little subsets of cardiology. Also for different subspecialties like neurology, for example, those neurologists generally become a primary care provider for people with chronic disease, severe disease within those subspecialties. We've had some people who go and are lobbyists in Washington, D.C., who work for pharma or industry, people who work for other big organizations. So CDC, NIH, we've had some graduates there as well. Our professors and faculty take a vested interest in our students graduating and succeeding in life. We're trying to prepare our colleagues and, future providers to help take care of our families as well. So we're not one of those programs where we have weed outs or we're not looking to, break students down. We accept the students that we want to be successful, and then we make that happen. I think that people who are educated at Michigan come out with a level of confidence that other graduates may not have. A lot of that tends to do with the fact that we have strong clinical placements. So everybody who is in a clinical placement from the University of Michigan, we have vetted those preceptors, whether it's from undergraduate or graduate graduate. So we trust them. They've been working with us for a long time. They're faculty within the university as well. So I think that we have people who are teaching the students both didactically and clinically, who are deeply familiar with the program, with the objectives. They're active nurses as well, and we look to produce people who are going to succeed and do well.